Alabama is one of the top states to be affected by the flu. That's according to the CDC.
Cases have surged to very high levels around the state. WDHN's Antoinette Godfrey has more on the growing flu crisis in Alabama and what you can do to reduce the number of cases.
Flu is spreading rapidly across the state. The Centers for Disease Control and Prevention reports Alabama is considered one of the highest affected states in the entire nation, which means the Wiregrass needs to be mindful of the spread.
It finally hit about Thanksgiving, and then with all people visiting, parties, family reunions, it started to really spread like wildfire. I think we are considering Alabama right now to be at a high level of flu. Most of the flu is covered by the vaccinations, but I think that there's a H3N2 that is not totally covered by the vaccine this year. And so that might be contributing a little bit to the spread of it and the numbers.
Doctors say a person can get the flu by touching a surface or object or by inhaling airborne respiratory droplets containing the virus from an infected person's cough or sneeze. Even if you just talk to someone with the flu, these particles move short distances and can potentially remain in congested places.
Children are so resilient, but besides that fact, the very young and the very old are at the highest risk of complications. The flu is usually fought off well within about a week or so, but occasionally it can attack a heart muscle, it can attack your lungs, it can attack your brain. I don't know the situation in those children, heartbreaking as it is. I can't comment on what they had.
2 young men in Alabama died from flu complications in recent weeks. One was 14 years old and the other was 11 years old. If you had it or you're lucky enough to not catch the flu, it's not too late to get vaccinated.
Flu vaccine is not a live vaccine, so you won't actually catch flu from the vaccine itself.
Antoinette Godfrey, WDHN News for the Wiregrass.